Hi, it's Dr. Ronald Lett from the Canadian Network for International Surgery. Today, we're going to look at the topic of emergency venous infusion, specifically tibial access. What are the indications? Inadequate vessels, inadequate perfusion in trauma or obstetrics, or in children. So shock is the major indication for venous access, and when you don't have adequate access, the tibia is there for you. Contraindications are limited. A fracture on that side of the tibia, the femur, or even the pelvis is a contraindication. Sepsis, where you would be placing your intravenous line, is also a contraindication. There are two alternatives in tibial access. One is interosseous infusion. The second is saphenous vein cut down. We will demonstrate both of these in this tutorial. For tibial venous access, you need to know some lower leg anatomy. First of all, the bone. Bone has a cortex, a marrow, and veins. When you do interosseous infusion, you go through the cortex into the marrow, which is attached to a very extensive system of veins. Thus, infusion into the marrow is as good as into those veins. The lower leg has superficial veins as well. The biggest one, the long saphenous, goes from the groin to the ankle. So for tibial access, you need to identify certain superficial anatomic positions. Let's start with the tibial tuberosity. The tibial tuberosity is identified by finding the patella. The patella tendon inserts into the tuberosity. You go 2 fingers below the tuberosity and just a little bit over to the flat part of the tibia. And this is where you can insert your interosseous needle. If you are choosing to do a long saphenous vein cut down, you have to find it. You find the medial malleolus. You go 2 finger breadths up, 2 finger breadths over, and that is where you will find your long saphenous vein. So for tibial access, lower leg superficial anatomy is important. The tibial tuberosity for interosseous infusion, the medial malleolus for long saphenous vein infusion. For tibial access, you need to practice how to put in an interosseous or how to put in a long saphenous catheter. So we'll start with the interosseous infusion. We have a model which has representation of a knee, tibial tuberosity, and a location for inserting your interosseous needle. This model here has skin and subcutaneous tissue. Interosseous infusion is a sterile procedure. I'm wearing sterile gloves. I'll prepare the skin with sterile solution. We have a fenestrated drape to keep the procedure sterile. If the patient is awake, we would take local anesthesia and infiltrate the skin. If they're unconscious, it's not necessary. So we put in a little bit of local anesthesia. You can put a nick in the skin to make it a little bit easier to get through. We have a number 16 needle. There are all sorts of special devices. You're not likely to have those in Africa, certainly in the under-resourced setting, but you will have a heavy needle and you will have a needle holder. And using a boring action, you can insert it. You feel it give as it goes through the cortex into the marrow. You would irrigate it to get any pieces of marrow out of the bone, and then you can do an infusion. This is a life-saving measure that you use for up to 24 hours while you're stabilizing the patient, and during that time you can get peripheral venous access.